Hello everyone, my name is Matthew Mancillas, and today I will be demonstrating a plyometric training session that focuses on speed, agility, power, and quickness. To start, we are going to do a general warm-up that usually consists of an aerobic activity to get the cardiovascular system going. In this case, I'm going to be doing a 10-minute bicycle, followed by dynamic stretching, main program segment, and then end it with a cooldown segment. It is important to start off with the warm-up because it leads to injury prevention, flexibility, and increased blood flow. The first dynamic stretch that I'll be demonstrating for the warm-up segment is the jumping jack. First, stand with your feet together and your arms at your side. Jump slightly off the ground, spreading your feet laterally shoulder width apart. Simultaneously raise your arms overhead, crossing them in front of your head. Jump back together, bringing your feet and arms back to the starting position. Continue repeating the movement, maintaining a steady rhythm. It is important to keep the core engaged, avoid hunching the shoulders, and focus on the quality of the movement rather than the speed. When performing jumping jacks, the primary muscles worked include the quadriceps, glutes, hamstrings, calves, shoulders, and core muscles, essentially engaging most muscles in your body, making it a great full body exercise. Continue this for 3.5 minutes. The second dynamic stretch for the warm-up segment are leg swings. First, the athlete should stand shoulder width apart. Keep one leg stationary, slowly swing the opposite leg anteriorly and posteriorly in a single smooth movement. Keep the abs tight, the upper body stable, and maintain a steady and deep breathing pattern. Actively use your muscles to swing the legs, and with each swing, take your leg closer to its full range of motion. Keep the movement fluid and swing the leg as high as you can without losing form. Forward leg swings are a great dynamic stretching exercise. The purpose of this exercise is to warm up and stretch the hip muscles and the hip joints. This movement helps to prevent injuries and also reduces pain in the hip area. Leg swings primarily work the muscles of the hip, including the hamstrings, quadriceps, gluteus maximus, hip flexors, adductors, and calf muscles, effectively stretching and warming up the entire lower body throughout a dynamic movement. The third dynamic stretching exercise for the warm-up section are the cross arm swings. First, the athlete should stand shoulder width apart and knees slightly bent. Raise the arms out to the sides at shoulder height. Engage the core by drawing in your lower stomach. Swing your arms medially and laterally, crossing one over the other at your mid-chest. Swing your arms back out to your sides, returning to the starting position. Keep the back straight and maintain a fluid motion. Allow a slight flexion in the elbow. Supinate the palms up as you swing your arms back to increase the stretch. Alternate which arms cross over the top. A cross-body arm swing primarily works the muscles of the chest and shoulders, including the pectoralis major, anterior deltoids, and serratus anterior, while also engaging the biceps and triceps throughout the swinging motion, effectively warming up and stretching these muscle groups in the upper body. Continue for 3.5 minutes. Exercise modality 1 that I'll be demonstrating is a lower body agility with an agility ladder, where the exercise that is being shown is a two-legged hop. To start, the athlete should face the ladder in an athletic position where the feet are shoulder-width apart, toes pointed outward, and knees bent slightly. Then the athlete quickly hops with both feet into each square, maintaining a quick and controlled rhythm throughout each of the squares. This exercise is great for focusing on the lower body, establishing the quadriceps, glutes, calves, and hamstrings. The first variation of the leg hop is a single leg hop, where the athlete is in an athletic position again, but while standing on one foot, and again jumping explosively through each of the squares. Ensure switching legs. This unilateral exercise is great for correcting muscle inequality in the legs, while also working again the quadriceps, hamstrings, glutes, calves, and adductors. Additionally, this exercise engages the core muscles for stability throughout the movement. The second variation of the leg hop is the reverse leg hop. In this variation, the athlete is in again athletic position, however, they should have their backs towards the agility ladder as opposed to facing it forward. Just like a traditional leg hop, the athlete jumps through each square explosively. This exercise is typically harder than other variations because it eliminates the ability to clearly see each square, hindering one's balance. Again, this exercise targets the glutes, hip flexors, and quads. The last variation of the traditional leg hop is a straddle hop, where the athlete is to assume athletic position facing the agility ladder. However, instead we are incorporating an extra step where the athlete also jumps outside of each square in addition to in. This variation is great for developing explosive lateral movements by hopping in and out of each square with a wide stance as well as enhancing stability and reaction time. Because of the explosive movements, this variation enhances the quadriceps, hamstrings, glutes, calves, and adductors. Again, make sure to go backwards and forwards. The second exercise for the lower body plyometric that is being demonstrated is a forward step. In this exercise, the athlete positions themselves in an athletic position facing the agility ladder, and then is to bring their knees superiorly, ensuring that only one foot touches each square alternately and that the arms are being pumped as in a running motion. The athlete is advised to keep a controlled, explosive movement throughout the exercise as it improves coordination and agility through speed. This exercise is great for utilizing the quadriceps, hamstrings, gluteus maximus, gastrocnemius, and hip flexors. The first variation of the forward step using the agility ladder is the double forward step, where the only difference from the traditional forward step is that the athlete should now place both feet into each square as opposed to one, ensuring the same technique as the traditional forward step, with the arms pumping and keeping a controlled quick movement through the ladder. Again, this exercise concentrates on the quadriceps, glutes, and hip flexors. However, this variation is slightly more difficult than a traditional forward step because of needing to concentrate on both feet going into the squares. Ensure to turn around and go through the agility ladder again. The second variation of the traditional agility ladder forward step is a double lateral step. In this exercise, the athletes again position themselves in an athletic position. However, instead of facing forward the agility ladder, the athletes position themselves perpendicular to the ladder. And again, move through the ladder in a controlled lateral motion with both feet entering each square. The athlete should switch leading feet in order to maximize the benefit of this exercise. When performing the lateral agility drill, the primary muscles worked are the quadriceps, glutes, hamstrings, adductors, and hip flexors. The last variation of the forward step is the side run, where again the athlete positions themselves perpendicular to the ladder. However, the athlete should ensure that now one foot goes into each square with legs crossing one another. This variation is much more difficult than the previous lateral step because of needing to now put one foot in each square in a tilted running motion. The primary muscles worked are again the quadriceps, glutes, hamstrings, adductors, and hip flexors. Ensure to lead with both feet for maximum benefit. First variation of the lower body plyometrics is a jump lunge. In this exercise, the athlete should start in an upright position with their arms by his side, engaging the core and setting the shoulders. Maintaining a neutral trunk, the athlete should jump and simultaneously split the legs into a lunge position. As you drop to the lowest position, explode into a jump and drive the hips upward. As you reach the highest position, quickly switch legs and drop it to a lunge. Jumping lunges work the glutes, hamstrings, quads, calves, and core. Do 10 reps. The first variation of the jump lunge is a lateral lunge jump, where the athlete should again stand shoulder width apart, knees slightly flexed. Maintain the same technique as a jumping lunge, explosively push off with your feet and jump sideways, landing on the opposite foot. Continue jumping back and forth between sides. This variation primarily targets the leg muscles like quads, hamstrings, and glutes, while also improving agility and quickness. Do 10 reps. The second variation of the lunge jump is a lunge to a single leg jump. Ensuring the same technique, the athlete should lower themselves into a lunge, then use their lead foot to explode themselves upward where the opposite knee is driven to the chest. This variation is much harder than a traditional jump lunge because of the need to generate enough force to bring the whole body upward on one foot. This exercise is great for utilizing the quadriceps, hamstrings, calves, and glutes. Do 10 reps. Exercise for the lower body plyometrics is a jump squat, where the athlete should stand with feet shoulder width apart. The athlete then bends the knees around 45 degrees, ensuring that the trunk of the body is pushing forward. Next, the athlete should explode off the ground, pushing through the heels of the feet and jumping linearly. The athlete should land with the knees again at a 45-degree angle, re-entering the squat position. This exercise is great at targeting the quadriceps, glutes, hamstrings, and abdominal muscles. Do 10 reps. First variation of the jump squat is a tuck jump squat, where this exercise involves performing a much more explosive squat than a traditional jump squat because of the added tuck. The athlete should stand with feet shoulder width apart and arms to the side, then squat down by bending the knees and pushing the hips back, keeping the chest linear and distributing the weight on the heels. Next, the athlete should jump explosively, bringing the knees superiorly towards the chest and tucking them as you jump. Land softly on the balls of the feet and immediately lower back down to a squat position. This exercise is great for increasing lower body strength and power, as well as explosive movements and agility, utilizing the quadriceps, glutes, hamstrings, calves, and abdominal muscles. Do 10 reps. Second variation of the jump squat is a Y stance jump squat, where the athlete continues to use the same technique for all other aspects of the jump squat, with the toes pointing outward, hips and knees flexed 45 degrees and pushing through the heels explosively, however with a much wider stance, returning to that Y stance on the way down. This variation is great for improving explosiveness because of the greater range of motion. Additionally, this variation primarily targets the glutes to a much greater degree than the hamstrings and adductor muscles. Do 10 reps. Third variation of the jump squat is a full dead jump squat, where the range of motion increases, causing the athlete to need to generate more power to explode through the jump. Because of this factor, this exercise is traditionally much harder than the regular jump squat. The athlete will continue to use the same technique as a traditional jump squat, with the feet shoulder width apart and the trunk of the body in a neutral position. However, as mentioned, the depth of the squat should be larger than 90 degrees, while ensuring that the trunk of the body stays neutral throughout this whole squat. Muscles work to the quadriceps, hamstrings, glutes, gastrocnemius, and soleus. Do 10 reps. The last variation of the lunge jump is a single leg lunge jump, where the athlete is in a split stance, hands together or arms bent at a degree of elbow flexion. Maintain a good posture with the torso angled forward, chest up, and knees slightly bent. Push the hips back and down, sink into the lunge until the right knee is a few inches off the ground. Be sure to maintain proper posture and balance. Drive the lead foot through the ground and explode upward. Land softly and repeat the lunge jumps on the left leg. You should feel this work in your glutes, hamstrings, hips, thighs, and trunk muscles. Do 5 reps each leg. Exercise modality 3 that is being demonstrated is the upper body plyometric with medicine ball chest pass. In this exercise, the athlete should stand up straight, facing a partner. Make sure there's approximately 5 feet of space between you. Holding a medicine ball with both hands, bring it up to your chest level, focusing the tension in your chest. Explosively toss the ball straight and forward toward the wall or have your partner catch it. Catch the ball as it bounces back and repeat the movement in rapid succession. A medicine ball chest pass primarily works the muscles of the pectoralis major, anterior deltoid, triceps brachii, rectus abdominis, and obliques, engaging them through the explosive pushing motion required to throw the ball forward, making it a great exercise for building upper body power and coordination. The first variation of the chest pass is a single arm chest pass, where the athlete begins with the medicine ball on both hands at chest level. The athlete then rotates the ball to one side while slightly bending down, bent knees, lean chest back, and hips slightly forward. Launch the medicine ball forward pushing with one arm and use the other for stability. Finish with bent wrist follow through. A single arm medicine ball chest pass primarily works the chest, the pectoralis major specifically, shoulders, triceps, and core muscles. Do 10 reps. The The second variation of the chest pass is a kneeling chest pass. To start, the athlete should set up by coming to a tall kneeling position, facing the partner, and holding the medicine ball at the chest. Bracing the core, aggressively throw the ball towards the partner in front of you, extending the arms fully. Catch the ball as it comes back to you towards keeping the core tight. A kneeling chest pass primarily works with chest muscles, specifically the pectoralis major, shoulders, and core muscles, with secondary activation of the triceps, as the movement involves a pushing motion to throw the ball with force while maintaining stability in the kneeling position. Do 10 reps. The last variation of the chest pass is a laying chest pass, where the athlete starts by holding the medicine ball lying on the back of on the floor. Raise the arms 90 degrees so that the ball is directly over the chest. Explosively press the medicine ball away from you, upwards into the air or towards the partner. Catch it with both hands and immediately explode it back up. This could be a great alternative if performing a solo workout. Primarily work with the chest muscles, specifically the pectoralis major, along with the shoulders, the deltoids, triceps, and core muscles, essentially engaging the upper body in an explosive movement, building power and coordination in the chest and surrounding areas. Do 10 reps. Second exercise for the upper body plyometrics is a medicine ball slam. Start by standing tall with shoulder feet width apart. Hold the medicine ball at chest level with two hands and sliding in hip bends. This posture requires bringing your abdomen towards your spine and rolling your shoulders back. Load the spring by squatting slightly. Take a deep breath and push through your heels to raise up on your toes. Slam the medicine ball between your feet with all your strength coming from your core and arms. When throwing the ball, exhale. In the upper body alone, this exercise targets the shoulders, chest, biceps, triceps, and upper back during the lifting and throwing motions. The first variation of the ball slam is the overhead ball slam, where you start by holding the ball significantly higher than your head, usually your arms length overhead, before explosively slamming it to the ground, engaging the core and lower body more intensely to generate maximum power in the movement. Maintain a stable stance with your knees slightly bent, allow the ball to bounce back up slowly and catch it to repeat the movement. An elevated medicine ball slam primarily works for shoulders, core muscles, abs and obliques, triceps, glutes, quads, and hamstrings, essentially engaging most major muscle groups in your upper body and lower body through explosive movement involved in lifting the ball overhead and slamming it down. Do 20 reps. The second variation of the medicine ball slam is a kneel slam, where the athletes to kneel down on the floor in front of a medicine ball. Keep the torso tall and grab the medicine ball with both hands, arch the back and slightly drive the hips forward and extend the arms to lift the ball overhead. Then drive the hips back, hinge forward, and slam the ball directly in front of you. A kneeling medicine ball slam primarily works your core muscles including the obliques, rectus abdominis, and triceps abdominis, along with the deltoids, glutes, and the quads and hamstrings. Due to the explosive movement and need for stability while kneeling on the leg, it also engages your back muscles to a lesser extent. Do 20 reps. The third variation of the ball slam is a crossover slam, where the athletes stand tall, holding a medicine ball in both hands to the left side of your hips. Swing the ball right and bring the ball open around your head, pivoting as you slam the ball to the opposite side of your body. Catch the ball on the bounce and repeat on the same side. The crossover medicine ball slam primarily works the muscles of your core, including the obliques, deltoids, latissimus dorsi, glutes, quads, hamstrings, and to a lesser extent your triceps, depending on the motion. 20 reps. The fourth exercise modality that is being demonstrated is the quickness reaction drills using a tennis ball, with the exercise being is the tennis ball drop. The tennis ball drop reaction drill is a drill that improves reaction time and hand-eye coordination. Stand in an athletic position, have a partner hold the tennis ball at shoulder height. The partner drops the ball without warning. As soon as the ball is dropped, run towards it and catch it before it bounces twice. Muscles worked are the latissimus dorsi, glutes, abdominal muscles, and quadriceps. Do 5 reps. The first variation of the tennis ball drop is a two-handed ball drop, where the athletes will have a partner stand across from you approximately 5 feet with a tennis ball in each hand. The partner then drops one of the balls at random. The athlete should sprint forward to catch the ball after it bounces twice. Throw the ball back to your partner and return to your starting position. This exercise primarily works the core muscles including the rectus abdominis, obliques, and transverse abdominis, along with engaging the shoulders, biceps and triceps, and lower back muscles. Do 5 reps. The second variation of the ball drop is a blind ball drop. To start, have a partner stand 5 feet behind you with a tennis ball. Have the athlete stand in an athletic position, and when the partner tosses the ball at you random, the athlete should then turn around as soon as they hear the ball bounce. Catch the ball before it bounces again. Again, this exercise works the rectus abdominis, obliques, and biceps and triceps. Additionally, this exercise is much harder being that the reaction is based off of sound as opposed to visual. Do 5 reps. The third variation of the ball drop is a double ball drop. In this exercise, the athlete should be 5 feet in front of the partner, holding an athletic position. The partner should again have the tennis ball in each hand and at random will release one of the balls. When the athlete goes to reach for the first ball drop, the partner should toss the extra ball over the athlete, so that the athlete should then locate the ball and catch it before it bounces twice. This exercise mainly works the rectus abdominis, obliques, quadriceps, hamstrings, and glutes. Do 5 reps. The second exercise for the reaction drill using a tennis ball is a tennis ball catch. To start, have the athlete stand 5 feet in front of a partner and hold an athletic position. The partner then tosses a ball to a random side of the athlete, to which the athlete is to quickly catch it while staying in athletic position. This exercise is great for working the deltoids, biceps and triceps, quadriceps, rectus abdominis, and glutes. Do 10 reps. The first variation of the ball catch is a shuffle ball catch. To perform the shuffle ball catch, have the athlete in athletic position with the partner being 5 feet in front of the athlete. The partner should then toss the ball at random. However, instead of staying in athletic position, the athlete is to shuffle to the side the ball is being thrown at. This incorporation of the shuffling makes this exercise much more tiring and difficult. The primary muscles worked are the core muscles, including obliques, rectus abdominis, and transverse abdominis, quadriceps, hamstrings, glutes, and hip abductors. Do 10 reps. The second variation of the ball catch is the wall catch. To perform the wall ball catch reaction drill, stand facing the wall a few feet away and have a partner throw the ball against the wall with varying forces and angles, aiming to catch the rebound as quickly as possible, focusing on reacting to the unpredictable bounce of the ball each time while shuffling to grab the ball. Again, this exercise primarily works the obliques, rectus abdominis, and transverse abdominis, quadriceps, hamstrings, glutes, and hip abductors. Do 10 reps. The last variation of the ball catch is a lateral face catch, where the athlete is to face perpendicular to the partner approximately 10 feet away. The partner then again decides which side to throw the ball, and it is the athlete's responsibility to use their peripheral vision to see where the ball is going, explosively turning backwards or running forward. This exercise is slightly more difficult than the rest because of the partial impairment of the vision. This exercise again utilizes the quadriceps, hamstrings, glutes, adductors, and gastrocnemius and soleus muscles. Do 10 reps. The fifth exercise modality being demonstrated is the snatch variation with a barbell, with the exercise being a hang snatch. To start, stand with the feet hip width apart and a barbell in front of you. Grip the barbell with a wide overhand grip. Bend the knees and hips to lower the bar to just above the knees. Brace the core and push your feet into the floor. Explosively extend your hips and knees, shrugging your shoulders. Squat down and catch the bar and straight arms over your head. Stand up straight, then lower the bar in front of you. The hang snatch helps develop postural strength and control, rate of force development, and confidence. A hang snatch primarily works on muscles of the legs, the quadriceps, glutes, hamstrings, deltoids, latissimus dorsi, and forearms, engaging multiple muscle groups across the body to generate explosive power from the lifting motion. Do 10 reps. The first variation, the hang snatch, is a tall hang snatch. First, the athlete should stand tall with the feet in the pulling stance and the bar hanging at arm's length in the snatch grip. Brace the trunk and ensure even balance over the whole foot. The tall snatch can be done starting on the balls of the feet. Initiate the motion by simultaneously lifting your feet and pulling your elbows up and out to around shoulder height to accelerate down to the squat. Aim to lock out the arms. Aim to lock out the same time you feel and hear your feet reconnect with the platform in your squat stance. This motion needs to be aggressive, forceful, and without hesitation. The goal is to elevate the bar as little as possible while you pull yourself down under it. A tall snatch primarily works your entire body, including the deltoids, traps, lats, triceps, and core, with a strong emphasis on the fast, explosive pulling motion to quickly get the bar overhead. Do 10 reps. The second variation of the hang snatch is a hang high pull. First, the athlete should brace the trunk forcefully and lower the bar under the control of the chosen hand position. Ensuring proper position and even balance over the whole foot, initiate the lift by pushing with the legs through the floor, maintaining even balance over the whole foot and actively keeping the bar as close to the legs as possible, and maintaining approximately the same back angle until the bar is past the knees. Completely snatch pull and rebase the trunk as needed before lowering the bar again for the next rep. The hang snatch pull increases pulling strength in a specific range of positions, so it can be used to focus on the liver's weakness. It can also often be used to load the movement more heavily and at least from knee height or higher. That can be done from a floor. A hang high pull primarily works the trapezius muscles, rhomboids, rear deltoids, glutes, and core muscles. Do 10 reps. The third variation of the hang snatch is the pause hang snatch. These exercises are done with lighter weight as the start position involves you holding the bar at chest height with snatch grip, elbows high. We like to start on the toes so that you can drop straight under the bar into the overhead squat position by moving downwards as you jump your feet out wider. A regression of this movement would be to start with the feet flat so that you can perform a small drive from the lower body. Another would be to slowly increase the squat depth if you struggle with getting to a full depth overhead squat this quickly. The main aim is to drop down fast so your arms can lock out as you hit the floor. Focus on your elbows being high and make sure that they move upwards and not backwards as the bar elevates. Primarily works the muscles of the shoulders, the deltoids, trapezius, core, and biceps and triceps with secondary engagement of the chest and lower back muscles. Do 10 reps. The second exercise being demonstrated is a traditional snatch. With a snatch wide grip, set the starting position tightly, feet approximately hip width, and toes turned out with the weight balanced evenly across them. Bar with the balls of the foot, knees pushed out to the sides inside the arms. Trunk braced forcefully and with the back extended. Shoulder joint above the bar, arms relaxed and straight, head and eyes forward. Pushes the legs against the floor through the whole foot similarly to the squat. Maintaining approximately the same back angle until the bar is above the knee, continue aggressively pushing against the floor with the legs and extend to the hips violently. Keeping the bar as close to the body as possible and ensuring full contact with the hips. Once you've extended the body completely to maximally accelerate the bar with the lower body, pull the elbows up and at the beginning move your body down. And pull your elbows up and at the beginning moving the body down and lift and move your feet into the receiving stance as you squat under the bar. Continue actively bringing the bar into the overhead position and fix it in place forcefully. The snatch exercise engages multiple muscles groups throughout the body, including the deltoids, trapezius, biceps and triceps, quadriceps, glutes, and hamstrings. Do 10 reps. The first variation of the traditional snatch is the power snatch. The power snatch is the most basic variation of the snatch. The only difference is that the lifter doesn't squat to the full depth when receiving the bar. This makes it a simpler lift for learning and more accessible to new lifters with limited mobility, but also serves important purposes in training for more advanced lifters, such as training explosiveness in the pull, better timing in the finish, and pull under, and a more accurate turnover. Again, all aspects of the traditional snatch should be utilized in the power snatch. The muscles worked are the trapezius, the adductors, the quadriceps, the hamstrings, gastrocnemius. Do 10 reps. The second variation to the traditional snatch is the block snatch. The primary purpose of the block lifts is forcing a more aggressive and complete finish off the pull and a quicker turnover. Most commonly, the lift is done with the bar starting at knee height, but it can be positioned at any level to address whatever technical performance needs desired. Higher blocks will emphasize power and aggression more, and lower blocks can be used to train problem ranges like navigating the knees properly and maintaining posture. Start in the same position you would be in during any power snatch with the bar at the height and even balance over the whole foot. Pressurize and brace the trunk, then initiate the lift by pushing with the legs through the floor, keeping approximately the same back angle until above the knees. Continue aggressively pushing against the floor with the legs and extend the hips violently, keeping the bar as close to the body as possible and ensuring full contact with the hips. Once you've extended the body completely to maximally accelerate the bar with the lower body, pull the elbows up and out to begin moving your body down, and lift and move your feet into a receiving stance as you squat partially under the bar. This exercise primarily targets the trapezius, the hamstrings, the quadriceps, the glutes, and the adductors. Do 10 reps. The third variation of the snatch is a muscle snatch. Set your snatch starting position and push with the legs against the floor through the whole body, through the whole foot similar to a squat, maintaining approximately the same back angle until the bar is above the knee. Continue aggressively pushing against the floor with the legs and extend the hips violently, keeping the bar as close to the body as possible and ensuring full contact with the hips. Extend the entire body closer vertically rather than leaning the trunk further back as you would be in a snatch. Keep the legs tight and pushing it to the floor as you pull the elbows up and maintain as much as bar speed as possible, shrugging up and back as you down. As the elbows reach approximately shoulder height, turn the bar over, squeezing the shoulder blades back to keep the bar as close as possible and continue to actively pull on the elbows. Remain the same height rather than dropping. Finish the turnover as you would a snatch, punching straight up into the bar over the back of the neck with the head pushed through the arms. This workout, the snatch is a full body exercise that works many muscles, including the glutes, quadriceps, deltoids, trapezius, hamstrings, and core muscles. Do 10 reps. The sixth exercise modality is the quickest reaction drills with a partner and no equipment, with the exercise being the mirror drill. To start, have the partner stand approximately 5 feet in front of the athlete with both the athlete and partner in athletic position. The partners then decide what explosive movements they would like to do, whether it be a side shuffle, sprinting, or backpedaling, and it is the athlete's job to mirror these movements to the best of their ability. This exercise is great for improving body control, explosive power, and lateral quickness by strengthening the glutes, hamstrings, quadriceps, and gastrocnemius. Do 10 reps. The The first variation of the mirror drill is a side shuffle, where now the main focus is the lateral quickness. To start, have the partner stand again 5 feet in front of the athlete with both the athlete and partner in athletic position. The partner should then side shuffle to whatever side they decide on at random, and it is the athlete's job to react to these shuffles in a timely manner while trying to maintain athletic position. This exercise can be difficult because of the reduced and explosive movements that are being incorporated. This exercise is best for strengthening the hip abductors, gluteus medius, quadriceps, and gastrocnemius. Do 10 reps. The second variation of the mirror drill is a reactive trail reverse, where the athlete stands 5 feet behind or in front of the partner, depending on who's leading, and instead of moving laterally or backpedaling, the athlete is to follow the sprint of the partner, and when the partner decides to stop and turn at random, the athlete should then turn and sprint as well and repeat the motion of the partner, deciding at random when to turn around. This exercise incorporates a short distance explosiveness to turn and sprint, making it much more tiresome. This exercise is great for improving reaction time, the pivot and turn, and as well as working the quadriceps, abductors, obliques, gastrocnemius, and glutes. Do 10 reps. The last variation of the mirror drill is a stop and go drill. To start, the athlete should stand to the lateral side of the partner, both in athletic position. Then the partner should sprint forward, having the athlete follow, and at random the partner will decide to completely stop, ensuring that again the athlete follows through with the motion and while stopping in athletic position. The exercise focuses on the ability to react quickly and initiate movement from a stationary position, which is crucial in many sports, in addition to improving strength power in the quadriceps, hamstrings, glutes, and calves because of the sudden stopping motion. Do 10 reps forwards and backwards. The second exercise of the reaction drills with no equipment is the Q reaction drill, where in this case the athlete stands 10 feet in front of the partner, holding an athletic position. The partner should then use hand cues where left and right is side shuffling, closed fist is sprint forward, and forward pointing is the back pedal. It is the athlete's responsibility to follow through with these signs as best as possible, ensuring an athletic position throughout. Hand cue reaction drill primarily benefits by improving your hand-eye coordination, reaction time, and decision-making ability under pressure, making it particularly useful for sports or activities that require quick responses to visual cues. This exercise mainly targets the glutes, quadriceps, gastrocnemius, and the core. Do 15 reps. The first variation of the partner Q reaction drill is a go-Q call-out drill. To start, the athlete should hold an athletic position, feet shoulder-width apart. The partner should then yell go, and the athlete should then explosively sprint forward, and on the next go call-out, the athlete is to backpedal. This should be done without stopping, so the partner should cue the athlete continuously until the set is done. This exercise is great for auditory reaction time and rapidly changing directions by utilizing the quadriceps, gluteus medius and maximus, abductors, and core muscles. Do this 10 times.
Go. 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 Go.
The second variation of the partner Q drill is a left-right drill, where the athlete is to hold the athletic position with feet shoulder-width apart and knees slightly bent. The partner should then randomly yell left or right, and it is the athlete's responsibility to side shuffle to said direction while maintaining athletic position. This exercise is similar to the reactive side shuffle, however, because the partner is only calling direction and not doing them, it calls for a much more quicker reaction time. The left-right callouts are great for improving balance, agility, speed, and lower body strength by utilizing the quadriceps, glutes, adductors, hip flexors, and obliques. Do 10 reps.
Right. Left. Right.
Last variation of the Q reaction drill is a localized point drill, where the athlete should set up 3 cones in a triangle, ensuring that the athlete holds an athletic position in the middle, approximately 10 feet in front of the partner. The partner should then point to which side the athlete should go to, where the top and bottom portion of the triangle is a sprint and back pedal, and the sides being a lateral shuffle. Much like the hand cue drill, the athlete is continuously working. However, this variation is much more harder because of the shorter distance and unpredictable movements between cones, causing the athlete to have to explode more rapidly and quickly. This exercise is great at strengthening the quadriceps, hamstrings, glutes, calf muscles, and as well as engaging the core muscles due to the rapid changes in directions and explosive movements required quickly to react and navigate around the cones. Do 10 reps. The first static stretch of the cooldown segment is the toe touch, where the athlete should stand shoulder-width apart and your hands in front of you. Bend forward at the hips, round in the back, and lower the hands down your thighs until you can reach your toes, ensuring that the legs are linear and that there is no bend in the knees. The athlete should then grab both feet and hold 10 to 15 seconds. Then return to the starting position. The toe touch stretch improves flexibility in the hamstrings, calves, and lower back, while also improving posture, flexibility, injury prevention, core strength, pain relief, sports performance, and overall movement in the body. Do for 3.5 minutes. The second static stretch of the cool down segment is a chest and back stretch. First, the athlete should stand feet shoulder width apart and fully extend their arms anteriorly with hands locked, ensuring that there is protraction in the shoulder blades, holding for 5 to 10 seconds. Then the athlete is to reverse this movement by extending their arms posteriorly, again hand locked, however with shoulder blades retracting, hold it for 5 to 10 seconds. This exercise enhances the flexibility of the serratus anterior, trapezius, rhomboids, and latissimus dorsi. Do for 3.5 minutes. Last static stretch of the cool down segment is a seal pose. To start, the athlete should lie on the stomach with legs hip width apart, then place the hands pronated on the floor beside the chest, pushing up through the arms to lift your chest off the ground while keeping the pelvis and legs grounded, essentially mimicking the movement of a seal raising its body, ensuring that the neck is aligned with the spine and relax the glutes, holding the pose for several breaths while adjusting the position of the hands to find the right intensity for the lower back. The seal pose primarily stretches the muscles of the pectoralis major and minor, erector spinae, rectus abdominis, oblique, and rhomboids, effectively targeting the entire spine and promoting improved posture. Do for 3.5 minutes. And that is it for my workout video, guys, and thank you.